Good morning, everyone. My name is Mary Rose Sweeney, and I'm head of the School of Nursing, Psychotherapy and Community Health at Dublin City University. Ordinarily, we would be hosting you in our lovely, bright, airy building at DCU, where we would have the opportunity to meet and mingle and make the most of our celebratory day. But instead, we have to do this virtually, so hopefully we can make it a celebratory event and something really meaningful and memorable for you all. So I'm absolutely delighted to welcome you this morning to our celebration of nurses and midwives under the theme of globalisation. So thinking globally and acting locally. And over the course of today, we'll be exploring this concept in some detail and thinking about what it means for us, what challenges it poses for the professions, and hopefully thinking about some solutions to the many challenges that we face in the years ahead for the health service. But first, I want to acknowledge the absolutely grueling year that nurses and midwives have had in the face of the most mammoth of challenges. I'm referring, of course, to COVID-19, something we all hope we will never again witness in our lifetimes. Nurses and midwives put themselves at risk for the sake of others. Many became ill and some even died doing their job. And I think that's something that is, it's quite difficult to absorb the full impact of that. The pandemic has really lifted a lid on the work of nurses and midwives and their value in society. Their response to the pandemic was heroic. And I know some people don't like that tag, but it was heroic. You literally risked your own lives for the sake of others. Today is our opportunity to say Happy International Day of the Nurse and the Midwife to you all, and to thank you for everything you have done, especially over the past year or so. And you will all be aware of the many challenges ahead for the health service, including a global shortage of nurses and midwives. And as educators, we need to significantly escalate the education of nurses and midwives, both emerging from the school leaver cohorts, but also from the graduate entry routes. This year, you will probably be aware, there has been a significant increase in CAO applications for nursing programs, but we will need many more resources in HEIs and in clinical partner sites to facilitate this intake, this increased intake. The education of nurses and midwives is expensive. It is resource intensive and needs significant infrastructure. And we will need significant government investment in order to continue to provide a quality education to support these increasing intakes. We are also facing into a major health service reconfiguration, which will see many changes in the way nurses and midwives function in their roles as care moves from acute settings into community and primary care settings. This will require some upskilling, increased levels of autonomy, and associated regulatory and indemnity changes. And we need immediate action to better protect nurses and midwives from burnout, exhaustion, and to tackle issues of retention. We need to think about active supports, for example, clinical supervision, which is routine practice for some professional groupings, such as for our psychotherapy colleagues here in our own school. So we have a very exciting program ahead of us today with a series of keynote talks, followed by panel discussions with Q&A sessions, both in the morning and the afternoon sessions. And just to let you know that the scheduling of our speakers relates to the time zones from which they are coming in today to allow them to be part of the panel discussions so that they don't have to get up in the middle of the night to speak to us. So that's why our speakers from China and Italy are in the morning session and our speakers from the US are in the afternoon sessions. And just to note, there are attendees from right across the globe joining us today as well. Also, as part of our celebratory event today, DCU will confer the award of Doctor of Philosophy virtually on Annette Kennedy, President of the International Council of Nurses, and on Vivian Lusted of the Irish Red Cross. And just to alert you, there are separate Zoom links for the talks and for the honorary conferring. So you will have to leave the Zoom link that we are on right now and go into the link for the honorary conferring. So somebody can put that up on the chat box for you just before that happens, so that you'll know which one it is. And then after lunch, come back in on the original link that you came on this morning at 2 o'clock for the afternoon sessions. So in the closing segment of the day, we are giving a national award to Ireland's most inspirational nurse and midwife. And nominations have been coming in over the past few weeks from peers and from members of the public who have been recipients of care from the individuals who have been nominated and who will be awarded today. So these awards will be made by the Dean of the Faculty of Science and Health, Professor Michelle Butler, as part of her closing address this afternoon. So if you have any questions that come to your mind as the speakers are giving their presentations this morning, feel free to put them into the chat box at the bottom of the Zoom screen as you think of them, and we will collate them and then pose them to the panel during the Q&A sessions. And I want to finish up by thanking all of our speakers. I hope you all have a lovely day today. And now it gives me great pleasure to announce our first speaker of the day, Miss Georgina Bassett, Honorary President of the Irish Association of Directors of Nursing and Midwifery. Thank you very much, Georgina.